President Biden's cancer diagnosis, what it means, and why it matters for every man. News broke recently that President Joe Biden has been diagnosed with metastatic prostate cancer, a revelation that's both deeply personal and widely significant. Beyond the headlines and medical jargon, it raises important questions about men's health, early detection, and how cancer journeys unfold, no matter who you are. Let's break it down in a clear, compassionate, and real way. Metastatic prostate cancer means the disease has spread beyond the prostate, most often to the bones or lymph nodes. In Biden's case, it's the bones. That puts him in a smaller but serious category. Roughly 5% to 7% of prostate cancer cases in the US are already metastatic when first discovered. This matters because early-stage prostate cancer is highly treatable, with a 5-year survival rate near 100%. But when it's already spread, that number drops to about 37%. Even so, these are just statistics, not destinies. Every person's body responds differently, and treatment options have come a long way. The journey likely started when Biden experienced urinary symptoms, a common red flag in men over 60. A digital rectal exam, DRE, may have revealed something suspicious, a firm, irregular bump on the prostate called a nodule. Think of it like feeling a hard knuckle where there should be soft, symmetrical tissue. Not every nodule means cancer. Sometimes it's just an enlarged prostate or harmless calcifications. But in this case, further tests, including a PSA blood test, imaging, and a biopsy, confirm the diagnosis. Once cancer is confirmed, doctors use something called a Gleason score to grade how aggressive it is. The scale runs from 6 to 10, with higher numbers indicating faster-growing cancer. Biden's Gleason score is 9, a serious sign that his cancer is highly aggressive and needs swift, targeted treatment. Getting the news of advanced prostate cancer is devastating. There's fear, there are questions, and yes, the big one, how long do I have? But the truth is, there's no one-size-fits-all answer. Treatment becomes a deeply personal journey, tailored to the individual's health, age, goals, and response to therapy. President Biden's treatment, like that of many patients, will involve a multidisciplinary team: urologists, oncologists, radiologists, and supportive care specialists, all working together to manage the disease and maintain quality of life. Unlike early-stage cancer, which can often be cured with surgery or radiation, metastatic prostate cancer is treated with the goal of slowing it down, easing symptoms, and extending life, while maintaining as much normalcy as possible. Common treatment strategies include hormone therapy, ADT. This cuts off the testosterone supply that prostate cancer cells thrive on. Chemotherapy, used when hormone therapy isn't enough. Radiation therapy helps target pain and symptoms, especially when cancer reaches the bones. Immunotherapy precision medicine, newer, high-tech approaches that either boost the immune system or target cancer cells based on their genetic profile. Supportive care focuses on reducing discomfort, fatigue, and side effects so patients can live better, not just longer. Of course, these treatments aren't without their challenges. Patients often deal with fatigue, mood swings, sexual side effects, muscle loss, and hot flashes, not to mention the emotional toll. But with the right care team, many men live full, active lives while managing their condition. Biden's diagnosis shines a spotlight on a crucial issue: men's health awareness. Prostate cancer is the second most common cancer in men worldwide, and early detection saves lives. Yet too many men skip routine screenings or ignore symptoms until it's too late. A quick exam or PSA test could be the difference between catching it early or facing a tougher road. President Biden now faces a battle that millions of men around the world are quietly fighting every day. His diagnosis is a sobering reminder that cancer doesn't discriminate by age, status, or title, but it's also a chance to bring attention to something we often avoid talking about: the importance of routine checkups, early intervention, and facing tough news with courage and clarity.
Subscribe for more interesting videos and hit the like button.